So welcome to the first class here at the Eden Cafe. We are doing the class called Heroin is Here. You can't hide from it anymore. My name is Karen Lang. I am a public health educator. I train people across the country and locally on how to navigate the healthcare system better. And this class comes out of that. Does anybody here know what public health is in general? Because it's a really sort of unique specialty. Are either of you public health trained at all, or just from different?
By experience.
By experience, okay. So public health itself is the study of injury, illness, and death in order to help people live as long as they can with a minimum amount of disability. And we do have 5 specialty areas to that. Epidemiology is our research end. Those are the people who tell you that coffee is good for you, coffee's bad for you, coffee's good for you. The good news for Eden Cafe is coffee's good for you. As long as you don't smoke cigarettes with it, dunk donuts in it, or put lots and lots of cream and sugar in it. We also have an environmental health piece. It's are known right now primarily for fracking laws and for working with whether or not that's truly a healthy or unhealthy thing for the environment and for people. We have policy and management. They make the laws, seatbelt laws, laws about hospital workers wearing masks if they haven't had flu vaccines, all came out of public health in an effort to stop the spread of illness and diseases. We have a biomedical sciences unit that takes technology that other people have done and uses our research piece to look at improving them. So for seniors, one of the big ones we did was add seats to walkers. You know, we realized that a disabled person using a walker got halfway across the mall and couldn't walk anymore, needed to sit down. So in order to avoid the disability of not being able to walk all the way across the mall, we add a seat. They were very practical. Public health is an incredibly practical piece of the healthcare world. The 5th section is social behavior and community health. That's my specialty. How do I change an entire society and get them to live a healthier life? And I do it primarily by teaching group classes just like this. And I teach on the basis of skills called health literacy. Health literacy composes 3 pieces. Can you navigate the healthcare system whether you're healthy or sick? And that doesn't just mean using your doctor in Western medicine. If you primarily use a chiropractor, you primarily check in with a vitamin specialist, you primarily use a Reiki practitioner to get your health information from, you still have to be able to communicate your medical and healthcare needs well. So it's a little bit broader than just the typical U.S. healthcare system. It's also whether or not they are healthy or sick. So if they're healthy, how do you stay that way? What's coming up in the future that you might need to be aware of? How do we age well? Those kinds of questions. How do we transfer from being a teen under our mom's care to being an adult doing our own care? And then the skills and knowledge. Second is the skills and knowledge needed to make those choices. Take all you've learned from your medical provider, bring it into your life, and make good everyday healthy choices. And that's where the Heroin class comes in, that ability to make good healthy choices and avoid things that are going to put your health at risk. And then we also have a piece of it that is responding in a public health emergency. So public health emergencies are not, I've fallen and I can't get up, or my neighbor's had a heart attack. They're bigger than that. They're boil water advisories and evacuations and things that are community-wide. And again, because I teach on primarily an individual health level basis as well, I'm really trying to get to the people who have chronic illnesses, who are aging, for whom not being emergency prepared is really going to put their health at risk. as opposed to the average person who can probably get away with an evacuation order with just their clothes or not going home and getting anything. A diabetic's going to need their insulin supplies for a few days. A senior's going to need all their heart medication. You know, a person with schizophrenia is going to need their meds and need to feel safe and comfortable in the same time. So the more we can prepare them for that process, the better off they are. So what do you think of as health? What is health in general for you guys?
I would think health is anything that prevents somebody from living the life they want to live.
That would be, yeah.
Anything that contributes to, so it's not necessarily a medical illness, or it could be a number of things that get in the way of someone living the life they want to live.
Right. That's a good way of describing it. Do you have another suggestion before you take a bite? No? Lily? You got anything over there? What health is?
She said the same thing. She said just on the other side. Health is being complete. Mind, body, soul.
Right. So from public health side, there's definitely that physical health piece to it. What can my body do? There's also a mental health piece to it. How do I think? How do I feel? There's a social health piece to it. How do I interact with friends? Can I hold down a job? Can I save for my retirement? And then there's a spiritual health piece of it as well. Where do I find that sense of peace when things are going wrong? Where do I find that sense that I have a purpose in life when I don't always feel that way? And as you are younger, you tend to rely more on physical and mental health. As you age, you tend to rely more on social and spiritual health. So there's a definite breakover somewhere around 60 where you see sort of as people decline physically that they take that, the other two sides of the health piece take over and really create the feeling of being a healthy individual, even though their body can't do what it did 20 years ago. So when we're talking about heroin, the question is, what do you really need to know about the current heroin issues going on in the area? And, you know, I looked at a lot of the studies that were done out on heroin. I looked at a lot of the different things that are already being trained in the area. And it really came down to 6 things. How do heroin or opioids work in your body? How do people access the drug for the very first time? Because that's really sort of a key point. Repeated addiction is very different than that first entry step in. Why repeated withdrawal and restart is highly dangerous. Why that kills you when it doesn't kill you with any other addiction. What does an overdose actually look like if you're out in the community and you see an overdose? What to do if you see one, and then are there laws that protect you whether you're having the overdose, whether you are the drug abuser having the overdose, or you are somebody who is there in the area when the overdose occurs. So in general, we're going to start with that. How do opioids work? So we all have these receptors in our brain that are designed to use the natural serotonin and other opioids that live in our body to help calm pain and to release trigger for pleasure. It's that dual combination which happens in opioid drugs. It doesn't happen in any other drug, and any other hormone in our body where it can reduce both pain and pleasure. That is what triggers such an incredible addictive process, because it's not only reducing our physical pain, but it's triggering pleasure sensors and things that say you're going to get rewarded for not having pain, as opposed to we just don't have pain. We get a reward as well. So it's the combination that makes that drug more addictive than something like alcohol that can reduce our pain level but doesn't trigger a pleasure effect. We know right now that there are 3 major receptors in our brain that handle that, and we are looking now at how those receptors interact with each other. Do they all do pain? Do they all do pleasure? Do they do a little combination of both? And is there a way to help an addict to chemically avoid the receptor that's going to cause a problem if they continue to use the pain? Ideally, we want to shut off the pleasure reaction to having the opioids go into their system so that they're not getting the reward for the pleasure without stopping that internal system from working for ourselves so that we can still feel pleasure from the everyday life. Does anybody have any questions about that, how that works?
There's a chemical you can get at the pharmacy for those that overdose. Is that for this?
There is a, yes, there is, we're going to get to that. Yep, there's a naloxone or Narcan, it's the 2 name brands for the drug. Yeah, and we are going to get to that. There are, you don't get it at the pharmacy, but you can actually take a training class and carry it with you if you're likely to see it happen. Is it offered over the counter as well? You can get, yeah. You can get them for free for taking the training class though. So why would you go pay to have it over the counter when you can sit in a class and they'll hand it to you for free at the end of the class.
For those that live in an area that.
Yes.
Right.
Yeah. So first time users, we still think of this as a heroin thing. I think my age especially still tends to think of heroin as a needle problem or smoking crack, those kinds of things. But what's driving the current opioid problems is actually the pain pills. Okay, and that's where people are getting that first step into it. And then they're moving from there to the more hardcore drugs. They get them from prescriptions that were written out for themselves that they abuse. If you don't recognize that you need to stop taking your pain meds when you're done feeling the pain, if you don't sort of taper yourself off of them and you keep taking them, you will build into your body a system that says, I need to have that drug all the time, just like a regular addict would. Being careful, you need to take the pain pills when you prescribe them to control the pain, but you also want to be careful that you're not abusing those pain pills either. But more people get them. They're given by a friend who had pain pills left over in a really natural kind of, like people would hand off a Tylenol or an ibuprofen. People will now hand off a codeine. These doctors prescribe them so comfortably and so regularly that you don't realize that there's that addictive quality to them that doesn't happen when you take ibuprofen for pain relief. It's very natural for people to get those first dosages unregulated at all from a friend. Sometimes it is somebody who has stolen them from someone, a grandparent who's got the pain pills, the mom who's got the pain pills, and the teenager will steal them and take them or steal them and sell them to his friends. And then finally you get sort of the drug dealer side of it. So again, the entryway into this is so much more gentle than the entryway is when you think about the old-fashioned ways of ending up as a heroin overdose. You know, you think of it as, well, I would never abuse, heroin, I wouldn't do shots, I wouldn't smoke crack. But a friend who suggests you take this pain pill because your back hurts and, they had a backache last month and that's what the doctor gave, that almost seems more reasonable. But then if it's working against your biological inhibitions or you're more sensitive to it, it can end up addicted to the pain meds themselves. The other problem with pain meds is there's the tolerance factor. Opioids are one of the things that you need more and more of them in order to reach the same level. And that's one of those key pieces that sort of helps you identify where you're crossing over from appropriate pain use to inappropriate pain use. If you came out of surgery and you needed one pain pill every 4 hours, for the first week or so, and then all of a sudden you're like, one's not cutting it, I need two, you've probably biologically crossed a threshold from your body using it as pain relief to your body being addicted to it, and you need to stop using it. The problem is that most people will still focus on the pain. They won't realize that they need to come off the drug and give themselves 48 hours off the drug for their body to adjust to not having it in there, and then give themselves a chance. If they do it early on, if they can catch themselves early on, they don't end up in an overdose situation because they can shake it off themselves. Repeated surgeries, though, if you go back and have a lot of surgeries and you're constantly taking morphine or codeine for pain, over time, your body can build up a tolerance that it doesn't work, even though you've gone maybe 8 months, a year, 2 years, 3 years without touching it. Your body's still kind of chemically attached to that first pill or that second pill, and it goes back there and wants that level again. Opioids are one of the few classes of drugs that build up and reduce tolerance pretty quickly as well. And this is where you end up with the starting and stopping thing. If you go long periods of time, you're going to end up addicted, but it's not deadly. But if you do short periods of time, your tolerance drops in 72 hours after you've taken the last pain pill, down to half. So if you were abusing and taking 4 pain pills at a time to control your pain, and you stopped, you went into a heroin withdrawal clinic or an overdose withdrawal clinic, and you were there for 3 days and you came down off of it, your body would drop down and only need 2 pain pills, or maybe only 1 in 72 hours to feel that same high again, to get that same pleasure reaction. And so what ends up happening is a drug addict isn't necessarily aware of that fact. So they'll go into a rehab center, come off the drug, sober up, go back out on the street, get into a position where somebody's offering it. He was taking the 4 before, so he takes 4 again, but now his body's not prepared for 4. And he's going to overdose because he's no longer got the tolerance level for 4. He's down to a tolerance level of 1. So that's where the start and stop. If you do that with cigarettes, if you smoke 3 packs a day and quit for a month or 2 and pick the habit back up right again at 3 packs a day, it wouldn't kill you. There's no tolerance level to that. This will kill you because it will literally send your body into, that's way too much of that chemical for what your body wants. So that's why it's really deadly, and we need to be very careful when we're taking somebody off of pain pills, that we're doing it properly, that we're doing it long term, and that we're training them not to restart at the high dosage that they had originally taken. Because it's very easy to start again, unfortunately, if you live in that lifestyle. So one of the ways we can avoid that is encouraging people who have a drug addiction. Look, if you're going to go out and you're going to abuse after you came out, at least remember that your body isn't ready to take on the big dosages you were before, and start with a lower dosage. Any questions about that? Did you guys know that? Yeah, okay, well that's your training especially, right? So it is that starting and stopping that makes the overdose issue deadly, especially when you're looking at like rural communities. Averill Park has a huge problem right now with the death of people using opioids because they're using them on the weekends only. So they'll build up a tolerance, come off it for the week, go back to work on the weekend, use it again at a higher tolerance, and end up ODing. So there are some distinct risk factors for overdosing, the loss of tolerance being the number one. We've done enough research to understand that it's that tolerance piece that's in there that is causing the most overdosing of it. It's not the heroin guy that's been on it for months that's likely to overdose and die. It's the guy who's coming on it and off it and on and off it. Mixing drugs, though, that's where you're going to see it in the long-term users, the ones that mix it with barbiturates and other drugs. Using alone as opposed to with a group of people, you're much more likely to overdose because you're not likely to pay attention. You can't catch your own overdose. If you're with a group of people, somebody else will notice that you're overdosing and hopefully react. So people who use it alone are much more likely to OD and die. The natural variation in drug strength and purity, moving from one brand of drug to the other, moving from, swallowing it as a pill to crushing it, moving it from there to heroin, where you get your supplies, all of that increases the likelihood that you'll end up with a stronger or a weaker dose and end up overdosing as it. Being seriously ill when you're overdosing, not just chronic illnesses, but even just a cold, brings down your immune system and makes the opioid so much stronger, even at the same level as what you had taken the day before, and can put you in that kind of a risk. Depression, because you're not paying attention so much to what you're doing, in particular. People who have unstable housing, if they don't live with a family, if they're traveling around, if they're living out of their car, if they're not checking in with people on a regular basis, are much more likely to overdose than others. A history of previous overdose, obviously they haven't really learned, and then moving to injecting it as heroin is also going to increase your risk factor for overdosing. So mixing drugs, I know you know, but the big problem with mixing drugs is you don't get a one drug plus one drug equals two drugs. You get a one drug plus one drug equals 10 drugs. Especially if you're combining them with other stimulants, or you're alternating barbiturates and stimulants to, kind of go back and forth, highs and lows. You're really playing around with a biochemical system that's not designed to be played around with that way. And drug interactions, yes. So, if you don't tell your doctor that you need a sleeping pill to go to bed at night and you're buying them over the counter, and then he prescribes you a pain med, you're much more likely to have a problem with overdosing because, he didn't realize that you're already taking something that's going to interact with that and cause a problem. And you're much more likely to become addicted to it as well.
Well, the good thing about pharmacies now is that it comes up. It's like nationwide. It's like it comes up.
Right.
Whatever you get in this pharmacy, whatever you get in that pharmacy, the pharmacist knows. It comes up when it's like controlled substances.
Right. Yeah.
Yeah.
You can tell. Right.
Those are the ones that usually don't interact well, and those are the ones that are really the ones that you're gonna have an issue with.
Right. The problem is you don't buy the over-the-counter sleeping pill. It doesn't end up in your medical records.
Right.
There's no way for the system to catch that you have this problem. And a lot of people take over-the-counter sleeping pills without even thinking about it. Like, it's just what they do, and it doesn't even occur to them. So that is that honesty with everything you take in terms of, vitamins or nutrient supplements or hand creams, all those kinds of things need to be logged in with your medical records, right with your doctor's office as to what you're taking as a drug. It doesn't have to be a prescribed drug. Anything you take, anything you put in or on your body to change the way you feel or to treat a symptom needs to be logged as a drug in your medical records. And then it will automatically check for drug interactions and overdose potentials. The other problem we have in general right now is that people think overdoses are instantaneous because that's what they look like when they show them on TV, you know? Well, I'll see the guy with the needle in his arm passed out on the floor like it's an instantaneous thing. And it's not. And so that's where classes like this can really help you to identify somebody who's overdosing. Overdosing is an overtime period. It usually takes a couple hours, and they move through some very specific stages. And if you see that and you can recognize that, then you can help somebody who is in the process of overdosing. The first stage is sort of heavy, uncontrollable nodding. They get really sleepy. You cannot give Narcan at this stage. If you give Narcan at the stage where they can still easily be aroused, you will shut off the reaction, but they will be very violent. Because they're still more or less awake and the body hasn't completely started to shut down. That person who's nodding off, who you can clearly tell is heading into an overdose, but hasn't crossed into sort of that unconscious side, needs to go to the emergency room and get treated with something slower acting that will pull them out more slowly. Or they sometimes get the Narcan in the emergency rooms as well, but the doctors are prepared for the instantaneous, abrupt violence that comes when you take a drug addict who is not completely overdosed and you give him a medication that shuts the entire system down. And then you have the person who's not responsive. That's the person you want to use that Narcan on out in the community. And there are some, their breathing is very, very shallow. Their lips have turned blue, their nails have turned blue, and if you don't respond within a half hour or so, they will stop breathing. That is the primary issue, is that they will stop breathing. So if the person passes out and appears to be overdosing, you want to shake them and shout at them to try to wake them up. That's the first step. If there's no response, then you need to do what's called a sternal rub, which is to rub your knuckles into their breastbone to try to wake them up. And you actually want to do it hard enough to actually leave a bruise. It should be painful. You're trying to stimulate their pain senses to wake them up out of the overdose. So if you're not getting in there hard enough to leave a bruise, you're not getting in there hard enough to waken anything that's left. Like it's good up here. Use your knuckles and go up and down their breastbone, up at the middle. Hard, like I said, hard enough to actually leave bruises. And there's a picture in there of the bruises. You can see the bruises on the guy's chest from where somebody tried to wake him up. If they don't respond then you should, if they don't respond to the sternal rub, you need to call 911. And if you have the Narcan, give the Narcan at that point. You want to make sure you call 911 because Narcan is a very short-acting drug. And it will wear off. And then if the person still has more opioids in their body, they will go back into an overdose and can die again. So you don't want to just give them the drug, go, oh good, they're awake, and leave them alone. You want to make sure that they're at the hospital where they can be monitored. They made it another dose. The containers you buy now with the little packets that you can buy over the counter or do the training and get over the counter come with 2 doses. Because they expect that you may have to give a second dose if they're heavily overdosed. And what that medication does is to actually take and bump the opioid drugs, the cocaine or the heroin, out of the receptors in the brain and replace it with an Narcan receptor. It's designed to be a stronger magnetic attachment. Magnetic's not a great word, but it's a good description. A stronger attachment to that opioid receptor than a regular opioid is. So, but it'll wear off and wander off, and your body will break it down, and then you'll have the rest of the opioids that the body hasn't broken down running through the system that can reattach. So you do want to make sure that if you are using that drug and you've woken them up with it, that you do get them into the hospital. If there isn't any naloxone, CPR is the next best option to try to keep their lungs and their heart beating and breathing. Because the problem really isn't that there's going to be brain damage from the amount of opioids in there, it's that their brain is no longer catching the breathing apparatus. You've stopped being able to breathe and shut that part of your brain down. So keeping the body oxygenated, keeping the brain going, keeping the circulation going helps to keep that person going till you can get them to the hospital. In New York State in 2011 passed a Good Samaritan law that specifically protects people who call in during a drug overdose and prevents the police and the district attorneys from searching the house, from making arrests based on a call in. And that's really, really important because otherwise nobody wants to call. So it protects individuals who have had the overdose. It protects the individuals that are calling in. It protects other people in the house. It protects them from arrest unless it's a very large dose, and I don't remember off the top of my head what it is right now. But it's much, much larger than most people, even drug dealers, would carry, because they really want to be able to get in and save people's lives. And it protects against prosecution for felony possession as well. It does not, however, protect against child endangerment laws. If you have a child in the house, somebody will get charged with child endangerment. Probably the parent for having the child in the building. That is the only place it does not cover, because New York State takes their children's welfare more seriously than anything else, which is a good thing. But you won't end up with the drug charges, you won't end up with the dealing drug charges, but you will end up with the child endangerment charges. So you do want to make sure, and obviously we don't want kids exposed to that kind of stuff anyway, so hopefully. Yeah, if there's no children in the house, it's okay. But if there's children in the house, then they are gonna charge somebody for child endangerment. That doesn't stop it. So I did give you guys a slide and the information for where to go if you want to take the class on how to get the Narcan for free, or the naloxone for free. It's Project Safe Point is the big one in our area that does them all over the capital region. So I gave you all the contact information. They will go for a minimum of 5 people. They will go directly to your house, to your place of employment, anywhere 5 people want to gather. They will go in and do this training, and you can walk away with the case. Yep, they'll come into churches, they do all that kind of stuff. Well, that is the end of the presentation on heroin and overdosing. There is at the back page of this the actual death rates and county rates of illness and stuff, in case you're interested in the numbers. I never think that the numbers are important, but there's always somebody who wants to see what the latest numbers are. So I did pull those actually off of Joe's report, the Project Safe Points report on their latest figures that they're putting out, just so you would have those if you want them. And then, like I said, this is my organization is a charity. We are tax deductible, so we do always appreciate donations into it, so we can continue to get the word out, especially to people who can't afford to come in. So we're all done. Thank you.